All right, let's get straight to it. Imagine this. You step into the bathroom, do your thing, look down, and your urine is blue. Not light yellow, not even dark amber, straight up blue. If you're a medical student like me, this probably sends your mind racing with all the possible causes you learned about. So, what's actually going on here? First off, let's bust a myth. Blue urine isn't some random superpower or a sign you've turned into a Smurf. In real life, blue urine is rare, but it's almost always related to something specific. Either something you've ingested or, in really rare cases, a genetic condition. Let's start with medications. One of the most famous culprits is methylene blue, a dye used in certain medical procedures and sometimes prescribed for urinary tract infections. It passes through your kidneys and, yep, colours your pee blue. Some antidepressants and multivitamins can cause a similar effect, but methylene blue is a classic. But wait, can food do this? Not usually. Blue food colouring is surprisingly poor at surviving the digestive tract, so it rarely shows up in urine. However, mega doses of artificial colouring, think eating a whole cake decorated with blue frosting, can sometimes do the trick. Now, for the rare stuff. Ever heard of blue diaper syndrome? It's a genetic metabolic disorder where babies can't break down tryptophan properly. The end result? Blue-stained diapers. There's also familial hypercalcemia, which can cause blue or green urine, but again, super rare. What about Pseudomonas infections? Good catch. Pseudomonas bacteria can produce pigments that tint urine blue or green, especially in catheterized patients. So if someone's got risk factors and shows up with blue urine, think infection, not just medication. And here's the key thing. Blue urine almost always has a clear cause. So if you ever see it, either in a patient or, hey, in yourself, don't panic. Instead, take a good history check for recent medications, supplements, or dyes. Rule out infection if there are other symptoms. And remember, most cases are harmless and reversible. But, and this is important, don't ignore it if there are other red flags, like pain, fever, or confusion. So the next time you hear about blue urine, you'll know it's not magic, it's medicine. And now you can explain it to anyone who asks. No Smurf jokes required. Stay curious.